Hi, I'm Dr. Chuck Wellman. I'm the Chief Medical Officer of Hospice of the Western Reserve. And I'm with you to talk about how do you make a referral for hospice care? How do we get a patient and a family ready for the fact that it's now time to consider hospice care? These are not easy conversations. Many of us have not received the type of training that makes us feel comfortable holding these talks. It also takes a lot of time, and in a busy schedule, that sometimes is not always present. One of the first steps is to make sure that we have the appropriate setting. Make sure that you have a quiet area, that you have an ability to sit down next to the patient, that we have the beepers turned off and the cell phone turned off, that you do not have any interruptions, that your nurse does not come in the middle of the conversation. You might also want to consider having a social worker or a nurse who is working with you present for this same conversation. That is both a support for you, but also that person may be able to help repeat aspects of this conversation to the patient at a later date. Step number 2 is finding out or establishing how much the patient actually understands about their illness. It's always a good idea to revisit what has been happening. And a good way to do this is to ask open-ended questions. So one might start by looking at the patient and saying, you know, we've been through a lot of tests here recently and you've gone through a lot of different treatments. Tell me what you understand so far about your illness. And then let the patient repeat back to you what they know or what they understand. This is a great time to correct any misinterpretations or misunderstandings. At this time, step number 3 is to ask the patient how much they wish to know about their disease and how far it's progressed, and if they are the right person to talk to, or whether you should be talking to anybody else. So be prepared that sometimes patients may say, well, I really don't want to hear more about this, or I don't want to talk about a prognosis, or please just talk to my wife about this, which is fine. So we want to respect those wishes. We also need to be prepared for the fact that sometimes family members will say, please don't tell. So at that point, the best response is not to say, well, I must tell the patient, or ethically I have to do this. I think a better response is to ask the family member, well, tell me more about that. Why is it that I should not tell? So explore that, but at the end, you would have to tell that family member that in all events, you still need to be honest with the patient if the patient wants to know what's going on. Many patients think that hospice care is intended for the final days of life. And so this is once more a time when you have to assess their understanding and explain to them that hospice care is for the final weeks and months of life, and that hospice can provide care in many ways and support for the family that would not be there outside of hospice care. Once you've addressed the fact that hospice care is the most appropriate avenue, then it's time to be silent for a few minutes. Let the patient talk. If their patient is not discussing how they're feeling, you can ask them, well, tell me what your thoughts are right now, or tell me how you're feeling. And again, wait for a response from the patient. This is your time to show emotional support for the patient, and that you will be there for that patient. And that brings us then to step 6, which is to reassure the patient and family that you will still be there for them, that they are welcome to call you, to talk with your office personnel, that you will be in contact with the hospice personnel, that you are arranging for a follow-up visit, that they should be bringing any questions or concerns that they have, that you will be there to help treat their symptoms. This is not a time to say that there's nothing more we can do. Patients really become discouraged and depressed when they hear that. Clearly, there may not be something further that we can do to change the course of the illness, but there's always more that we can do. And reassuring the patient that you will be there, that you will focus on their comfort, that we will be treating pain and other symptoms, I think that is the message that we need to give to the patient. Yes, the disease cannot be treated further at this point, but I will be there, and there's always something we can do to help assure your comfort. So let me go back quickly with these 6 steps. Set the stage, make sure you have enough time in a quiet setting, find out what the patient and family understand about their disease, find out how much they really want to know about their prognosis or about the type of care that should be appropriate at this time. Then introduce the topic of referral for hospice. Remember to allow time for the patient to emote in a little bit of a quiet phase. And then step 6 is giving that support to the patient and reassuring the patient and the family that you will still be there and that you will be helpful in guiding them through the rest of this illness.